We have a really unique curriculum here, and that is an integrated curriculum. That means that as we're being taught the sciences of being a physician, we're also taught the nuances of what it takes to actually be a doctor. So, for example, when we were taking our neurology unit, we also learned how to do the nervous system exam as well as the head and neck exam. And that's something that's pretty unique for a medical student in that starting from year one, we're in the hospital, we're seeing patients, we're practicing those skills that a physician does on a day-to-day basis. So as we're learning the knowledge base and the fact base, we're also learning the practice, which is pretty awesome. As a medical student, being in the hospital at least once a week, interacting with physicians, working with both standardized and real patients, it kind of helps to put things in perspective as a student and remind you what the end goal is.
Curriculum here at OU is very different in that we harbor an integrative curriculum. And what that really means for us is that we are able to learn all aspects of whatever organ system we are on. So for example, right now we had just finished up our renal course, and instead of dividing our classes based on learning everything about biochemistry, everything about histology, everything about anatomy, we focused on that specific organ system and what applied to that organ system. And I am able to walk away with this integrative curriculum really understanding the ins and outs of that organ system instead of having to feel that I'm trying to tie together different subjects.
I think that the integrated curriculum is one of the best parts of OUWB. It's one of my favorites anyway. I like that for an older student like me, I feel like, oh, I gotta learn a lot of things all over again. But then it's presented in such a way that they take the basic science, okay, you just learned this. This is what's normal in the body. Now here's how it can go wrong. At a lot of places, you learn the normal first year. Second year, you learn the abnormal. And so it's kind of like, well, maybe you've forgotten everything you learned last year. That's not going to happen here because you're learning it at the same time. And I think that makes a huge difference to be able to understand what's going on, how it can go wrong, and how you can treat it all at the same time. It's invaluable. And that's kind of like the horizontal integration that you get. But also you get integration across all 4 years. So we don't forget what we learned in the first year because in the second year we're seeing it again in more detail. So the things that we learned in the biomedical foundations of clinical practice come up again when we're learning cardiology. And we think we might have forgotten, but no, they revisit it over and over again, and everything ties in together, and that's really a great way for me to learn, and I think it works for most people.
The way OUWB integrates being a clinician into the first 2 years is that they allow us to interact with the standardized patients, and that's during the Art and Practice of Medicine course. So that's an actual course where they've set aside time for us to interact with people. But then the more clinical aspects of interacting with people in our basic science courses, they try to integrate into TBL. And a good example of this is during the cardiac TBL, when we would be given on Friday a case presentation in the morning, and like 15 cardiologists from Beaumont would come. And there would be one cardiologist per TBL team, so about 5 students, and we just discuss cases. And they'd ask us what kind of treatments we'd like to do, what kind of diagnostic tools that we'd like to use, and they just treated us as equals. And that was really neat to know that we're so brand new at doing whatever it is we're doing, but also to be talking to these people who've been doing it for 20 years, and they're really treating us like peers.
From the very first day, they don't focus just on presentation of the facts and then just rote memorization of those facts. It's really about, can you learn this information and understand the information and then apply it to something that you might encounter in the clinic with a real patient. In addition to that, too, the other thing that's pretty exciting is the Art and Practice of Medicine class, which, again, from the very beginning, granted, we're getting in there and just learning basic skills, but working with standardized patients from the very get-go, regardless of the fact that they're trained actors, it's just still super exciting to be in there and working with another real human being in that, role as a student physician, learning and practicing and being able to do it in a situation where you don't have to have the anxiety. You don't have to be worried about saying something silly or messing something up. It's an environment made to make mistakes and learn from those mistakes to make us better physicians in the end. So the focus on that from the very beginning is something that's really innovative for OUWB, I think. And again, it was one of the main reasons that I came here. They really talked it up in interview day, and it really has held true coming here. It's not just a false promise that they kind of waved around during interview day. It really has been an exciting addition to the curriculum from the very beginning.
I had an internship over the summer where I was at Beaumont for 6 weeks, and everyone there was like, what are you, a third-year medical student? Are you a fourth year? I was like, I just finished my first year. They're like, wow, you know so much, and you know how to talk to patients, and we're taught that right away. So I think that the integrated curriculum is huge here.